Let's talk vaccines now. Cabinet telling us today that the Health Minister is due to make an announcement very soon on the resumption of the Johnson & Johnson vaccination program. The pause button hit last week after the Food and Drug Administration in the USA raised concerns about 6 women who developed very rare blood clots, possibly as a result of that vaccine. We still need to finish off the first phase of inoculating healthcare workers. Of course, every day counts. At the same time, we're keeping a really close eye on the daily infections, with an uptick seen in 3 provinces, Northern Cape, Northwest and the Free State. Well, I'm joined now by the head of the COVID Ministerial Advisory Committee on Vaccines, Professor Barry Shube. Professor, thank you. Always a pleasure to talk to you. How soon are we likely to hear from the Health Minister?
I hope soon. I think, Sally, you mentioned that he's about to make an announcement shortly. The recommendation has gone from SAPRA to resume the vaccine program, and it's a matter of a couple of days that it'll start up again.
So we do know that SAPRA has approved it. I think the Medical Research Council has also given it the nod. Who else has been spoken to and said it's got to go ahead, to your knowledge?
Yeah, sorry, I'm not exactly sure. I think those are the 2 main players who would recommend lifting the pause. But obviously that final decision needs to come from the Minister and perhaps the NCCC, the Corona Council, the Coronavirus Command Council. They will probably need to give the final go-ahead.
Without wishing to preempt what the Minister is going to say to us very soon, what do you think he should be saying?
Well, I think he should have. I think we should obviously start the program as soon as possible. I think everybody feels that, and I think everybody's impatient that we start the program as soon as possible. You know, so far only just under 300,000 healthcare workers have been vaccinated. We've still got quite a long way to go with the healthcare workers. So I think that we really want to start as soon as possible. They're a critical part of delivering healthcare to the country.
I'm just wondering what the pause has actually achieved. My understanding is that the USA has still not seen any specific link between the vaccine and these very rare blood clots. They're saying they need more time to assess the Johnson & Johnson vaccine. What actually have the South African authorities done to make them a little bit more reassured that it's the right way to go?
Yeah, they've got a very intensive program. It's called pharmacovigilance. In other words, what it really means is following up in great detail any adverse events which are reported to them. And this is obviously a very prime one. So they need to look at, who gets these blood clots, what precedes it, who's at risk, and also, obviously, is there a causal link? That still needs to be established. There are some postulated mechanisms how the vaccine could cause it, but we need to kind of establish that it does cause it, and also how common it is, or the other way around, how rare it is, because it seems to be very, very rare, extremely rare. But on the other hand, it could select for who should and who should avoid getting the vaccine. These are critical information that needs to come, but I must emphasize it's an extremely rare complication.
Talk to us about the other vaccines. Pfizer's also going to arrive, and that's going to form the second part of inoculating the healthcare workers. Am I right?
That's correct, yes. So in other words, it's going to be a combination of the Johnson & Johnson and the Pfizer for the remaining healthcare workers.
Okay. Talk to us a little bit more about the concerns around Easter. We've been watching the numbers. Hasn't really shown anything too worrying. We know, though, it takes a good 3 to 4 weeks after any big event, such as Easter, where people tend to gather, before the numbers are impacted. There are 3 provinces that are somewhat concerning: Northern Cape, Northwest, Free State. Talk to us about those upticks. Talk to us about any concerns you have around the numbers.
Yeah, Sally, I think this is really what we were worried about. Would the Easter festivities be a super spreading event like the Rage Festival was the trigger for the second wave? I think we're all holding thumbs. So far, there hasn't really been signs that those festivities had launched a 3rd wave. We're obviously anticipating a 3rd wave, But so far, we haven't really seen it. The uptick in those these are really the three smaller provinces in terms of population. So it would be unlikely, but not impossible, unlikely that they would be the kind of herald of the third wave. But obviously, there is some concern. We need to monitor it. But fortunately, for the larger population-wise provinces, the KZN, Western Cape, Gauteng, we haven't really seen an increase in those provinces. And this is what, of course, where the kind of vigilance needs to be looked at.
Thank you so much for chatting to us this evening. Head of the COVID Ministerial Advisory Committee on Vaccines, Professor Barry Shoop.